The following program is rated GE. It is suitable for general family viewing.
Hello and welcome to this edition of Body Garage. This week, we delve into a problem that is oftentimes common, back pain. However, it gets so much ignored. And today in studio with us, we have Dr. Gerald Wasena to help us delve into it. Habari sana, Doc.
Mzuri.
Uko aje?
Niko salama.
Labda just introduce yourself a little bit.
My name is Dr. Wasena Gerald. I'm an orthopedic surgeon. And or a daktari wa mifupa. So we manage bones, joints, and muscles.
And muscles.
Yeah.
As well, in studio, we do have a live audience, youth from different parts of this city. Mkwaje? Mko salama? You're ready to delve into back pain, understanding what back pain is exactly? Yes. So, Doc, let's start. First, what is back pain? And before even you get to explaining what back pain is, where is the back?
Back is stretches from the tip of the buttocks all the way to what holds the head. So we have several bones on the back. That stretches all the way from the head to the buttocks.
Okay.
And so basically that's the back, and it consists of both bones, muscles, and ligaments. Okay. So the pain can come from any of the structures that are on the back. Yes.
All right. So, and oftentimes there's a cause to something.
Yeah.
So what causes back pain?
The causes of back pain is very broad. The causes are very broad, and when we're talking of the back, we first need to understand a little bit of the anatomy of the back. So the back is made up of structures. As I said, there are different bones that are on top of one another. So there are different bones that are on top of one another. And in between the bone and the bone, there is a soft, something spongy in between. Remember, the back allows us to do several movements.
Yes.
You can bend to different sides. You can bend forward and backward. You can even be allowed to twist. So because of that nature, the body has allowed the back to be made in such a way that the bones move in differently. They can rotate, they can go forward or go backward. So for that to be allowed, the bones are made on top of one another. Then in between the bones, there's something called a disc. Okay. A disc is something spongy that is in between the bone. One bone and another, there's something in between. And as you can see from that image, those are the bony structures, and in between, there's something spongy. Then from this bone is such inside that bone, there is like a hole that stretches all the way from the top to the bottom. And that is what's called, it is protecting something called the spinal cord. Remember, from your brain, there's something that sends messages all the way down. So it's like an electric channel. So it's being protected by this bone. So it does two things. One, it protects the spinal cord, and it also allows for the movement. And then there are muscles in between that are protecting also now the bones from being injured.
Okay.
So the pain can originate from anywhere. It can originate from the muscles. It can originate from the spongy part, that is the disc, or it can originate from the bone itself. Yes.
And when you're talking about this pain, what exactly then triggers that pain?
Yes, so the causes are different. The most common cause is muscle strain or sprain.
Okay.
As we walk, as we sit, as we do our day-to-day activities, there's a way the body was meant to be. Like currently your seat is not the best.
Yes.
Your seat is meant to have something here to support
the
posture. So when I wake up, when I go brush my teeth, there's a way I'm straining my back.
Yes.
When I go to sit on the chair, there's a way I strain my back. So that muscle sprain or strain is what is the first cause of back pain.
Okay.
Like 95% of the causes are that. Then the other causes is something we can talk about that are that come from different causes from here and there. Yes.
Okay, we do have our live audience here in studio, and perhaps they're wondering how then do they also suffer from back pain, or is it just something for the old people? Perhaps we could get one or two of you to speak up. Have you ever experienced back pain?
Yeah, so my name is Timothy Rar, and I've experienced back pain since there are times when I do lift heavy weights, and you find that after a while I experience the back pain. So is it because of the muscle strain that you said, or what is the cause of the
just
back
your
pain?
body cannot handle the weights?
Yeah.
So that's a good question, especially for the young. And currently there's, which is a good thing, there's everyone tends trying to go to the gym or trying to do some workout. And it is important for us to know how to do that, because that can also trigger pain. So there is a proper way of lifting the weight. It's the same thing, there's a proper way of, even the people who work in industries, there's a proper way of lifting those weight. If you are carrying a mizigo from one place to another, there's a proper way of lifting that mizigo. So I will probably, most likely, you've been lifting weight in not the proper way. So in due time, I think as the program goes, we'll explain to you a few ways or few tips on how to lift weight in the right way. Yes.
Okay.
I will also, just to make it easy for us, so the back pain, as I said, it's can be different causes. So there is, when pain is coming from the bone or from the muscles, you feel pain on the back, But you remember I told you there's a nerve that is passing on the back. And as it passes, it also gets out of the back to go to different part of the body. So you can have pain that comes from the back, but you don't feel the pain on the back.
Okay.
You feel the pain on your, one of the most common one is what is called sciatica. You feel the pain on your buttocks that goes all the way to their legs and even onto their legs. And we get this a lot, especially middle-aged ladies have a lot of it. They'll tell you they have pain on their buttocks and they're feeling the pain when they sleep at night. Their legs are feeling, they have numbness on your legs. So that pain is actually originating from the disc or from the nerve compression on the back. Some people, especially those young guys who play most video games or and they're always bending their neck, you find that with time, or the guys who are doing coding and computer program, with time they start feeling tingling sensation on their hands. It's because their neck, they've been bending their neck for some time, and that has causes irritation on their disc, so the nerve that is innervating is going to their hands are being pressed. Therefore, they feel some tingling sensation on their hands.
Okay.
Yes, I don't know if you've ever slept on one side
and then you wake up.
Yes. So you can imagine if you have something on your back, on your neck, that is what you'll be feeling.
Okay.
Yes.
All right. And how then do I differentiate probably an acute pain from a chronic pain, and how does that vary now with the ages?
Okay. So I didn't talk about this before, but it's good you've raised it. So most of the pain, like about 95% of our population will at some point have back pain. 95%. And most of it is due to muscle strain or sprain.
Okay.
And all you need is just to just change your activity or just take some painkiller, and that will go down. We call that acute pain, acute back pain. It lasts for about 3 months. So if the pain persists beyond 3 months, now it becomes chronic. And now we need to investigate and find what could be the cause of this pain. So in acute, it lasts up to 3 months, and most of the time it's self-limiting. If you change how you are sleeping or how your activities, the pain will disappear.
Okay.
Yes.
And then now, what about amongst the age groups?
Yes.
What pain is probably for what age group?
Okay.
Yeah.
So back pain affects all age groups. Acute will mainly affect the younger population, because they're the ones who will do activities here and there. But now the older people tend to get what is called chronic, because their causes are different. When now you get into what is called chronic back pain, you find that probably you didn't manage the acute phase well. As I said, much of this is usually muscle strain or sprain. Then because of that pain, you did not change your posture. You did not change the way your activity. Or instead of being active, you went and just became lazy, and you didn't move your back. So your muscles become weaker. And the more the muscles become weaker, the more the posture deteriorates.
Okay.
And now you get into a chronic phase. And so that is one of the reasons. So the people who are a bit older, from 40s and above, they tend to now build into what we call chronic back pain. But much of it, as I said, about 80% is just due to muscle strain or sprain that was not taken care of. Of course, there are other causes of pain, like what we now is a dangerous phase, what we call a red flag. Other people can have what is called infection. So there are few people who have, for example, TB of spine, and that is a few number of our population. There are people who are getting old, especially post-menopause. Your bone becomes weak. So for ladies, we encourage them to keep moving. Even after menopause, you need to take things that will make your bone not to be weak. So when these people get osteoporosis, if their bone is weak, they easily collapse.
Yes.
And now that causes chronic back pain. The other thing that is of concern is cancer.
Okay.
Cancer can also be a cause of pain, back pain, that, of course, if it's not attended to early it gets into a chronic phase.
Okay.
Yes.
Just hold on to those thoughts, but for now we will head on a short commercial break, and just as the doctor has explained here, it is quite a practical topic. So after the break we would have now the practical side of it, just seeing how different pains originate, where do they originate from, how can we then cure some of these things at home, remedy them at home. And so you can send in your feedback on our SMS lines, which is 22047, and we will be sure to sample some of those as the show goes on. But for now, do not touch that dial as we head on this short commercial break. Welcome back to Body Garage on TV 47. Glad to have you back as we try to understand back pain on this episode. And Doc, before we went on the break, we had promised it would be now a more practical example. What are some of the careers that are predisposed to back pain?
Okay. So as I told you, I work in an orthopedic hospital called St. Peter's, and we did a study amongst our patients to try and understand which population have more back pain. And we picked a few information from the statistics. Unfortunately, the most affected gender is female.
Is female.
And we picked is from their basically their career or their day-to-day job or work they do. And number one cause of back pain is of course home care. Okay. What I mean by home care is what we do on the day-to-day activity of living. And so a person who is waking up and washing dishes and washing the floor, they tend to get more pain. And we believe is from the way they've been used to. Ladies or most people, when they are washing their clothes, they'll tend to bend, and as they wash. And currently we advise that when you are doing your home chores, it's important to do it in such a way that you protect your back. For example, when you are, instead of washing when you are bending, just rather sit down.
Aren't we making people lazy?
But you should not bend.
So the problem is bending.
Is bending.
Okay.
The problem is bending. The way you bend when you're washing. By the time you finish your 30 minutes of that, you've already strained your back. So when you are, so number one is then the way the baby care. Most people or most women will either carry the baby on their back or they carry on the side. So when you carry on the side, you are bent, you've bent on one side. And most people, their dominant side is right. So they carry this baby on the right side. So they'll tend to lean on one side. So it is advisable, as I said, my colleague is seated here. When you're sitting, you need to sit on a proper way. When you see this seat, there is a certain curvature here. So you need to sit on a proper seat that has a curvature. Or if you don't have this seat, on your normal seat, you put some pillow here.
Okay.
You put a pillow here so that it makes the lower part to go in front.
Be upright. So when you look around at our live audience, are they seated upright to the posture that is needed?
Okay, they're trying. I think it's because they knew we are around. Posture managers. So yeah, they're trying. So as I said, the people who raise the baby care, they tend to also to get. So you can imagine you are a lady. You're from washing utensils. You go wash your clothes, and then you come take care of the baby. So that will predispose to back pain. So a big number are female, and there are who have been doing home cause. The other population that is increasing rapidly are office workers.
Okay.
Yes. We are seeing many patients who are from the office who just start with subtle back pain, then it continues. They say they just used to feel a little pain, and then now it has progressed, and now it has reached a chronic phase.
Does that come from sitting down most of the time during the day?
Yes. So we advise people who are working in the offices to sit on the proper chair. And if you are working, you need to sit like this, as my colleague, to ensure that there's this curvature.
Okay.
Now
you find that now most times in the office space there's a computer in front of you.
Yes.
Then how do I maintain this? And also. So
it has to be on the level. Your computer needs to be on the level of your head, of your eye. So you either bring the chair down, or you bring the table up.
Okay.
And in other countries and other institutions are also provided for long tables.
All right.
Yes. There's these tables, office tables, that you can actually increase the length.
And you can stand up and do your work.
Do your work. So if you're in the office, urge your bosses to provide for you the tables that you can adjust. And then you can put a routine, especially if you've started to notice you're having back pain. There are apps that are out here that you can actually monitor, that can actually prompt you to stand up and take a walk. If you don't have an app, just especially if you know you've started to get back pain, put an alarm so that after you sit for about an hour, take a walk for like even just 5 minutes, and just so that you reduce the strain and come back and sit.
Okay.
The other careers that we are seeing a lot are drivers, long distance, especially long distance drivers. But not only them, even people who are doing the taxis, or even people like with our roads, you find that you work and you stay in a jam for like 2 hours. And during that time, it is important again for proper sitting. I go back to the way you sit. Try and ensure that you maintain that, what is called the lumbar lordosis, or this curvature. And bring, if you are tall, just ensure that you maintain the steering at a position of comfort, because if it is too high, you also now strain your neck. Yes. Okay,
Doc. I think the clarion call that we are getting here, the main point is that ensure that your posture is upright. And so let's engage our audience today. What questions might you guys have for the doc?
For example, if you do splits over a certain period of time, you'll become adept in your legs and you'll stop feeling the pain. What makes the back so different that when you sit at the same position over a long period of time, you'll continue to feel more pain instead of it becoming relieving?
So there's the way the body was created. The back doesn't have it's not a straight, the bone, as I said, the back is not straight. It has curvature. There's a way, if you stand straight, I don't know if you can stand straight, you'll find that there's a curve here, then there's a curve that is coming outside, then it's curving inside again, then outside. So you can sit. So that is the way the normal position is, the way the body was created. So the reason why that is to ensure that there is what is called the mechanical axis. So that creates a balance between the muscles and the bones. So there is the head, and then there is the back, and then the legs. So now if you remove that curvature, that normal anatomy, it strains the back. And you will not adapt to that because it is changing the normal way of, the normal anatomy of that back. Yes, so that's the interesting thing with the back, is that it's made up of the curves and you need to maintain those curvature. Yes.
All right. Let's hear from a lady this time around. Do you have any questions for the doctor? Not really. So as she even thinks about it, what about my own weight? Can it be a factor to making me feel some back pain?
Yes, the other thing we need to talk about, of course, is when we're talking about the causes of back pain, sudden change of weight, like if you gain suddenly. You see the back has been maintaining a certain weight, then now you strain it.
Okay.
Then that being big or being obese will cause pain. And when also the obesity also causes the muscles and the back, the muscles and the bones to be weaker. And you remember, if you're, the key thing about our body is that we need to keep on moving. We need to keep moving. And this is something we advise patients who have back pain. Earlier on, the assumption that you should rest has been proven over time that it's not the best advice. Rest should be limited. Even if you have pain, you need to keep moving.
All right.
Yes, when you have pain, don't to go and rest. You need to keep on moving because that mobility makes the body to be more active, and that activity is what helps the back to continue going back to normal. Because if you get the pain and then you rest, now the injury becomes worse.
Okay.
Yes.
I'm
now,
getting
the other
a
thing,
question.
sorry.
Probably hold on to that. Still on the same. What about the women in the village? We normally see them carry heavy water on their backs. What then can they do different so that they can prevent the back pain?
So as I said, from the research at St. Peter's, we realized that ladies are the ones who have more pain, more problem than men, and it's because of their daily cause. And the other thing I need to mention that you need not to stop doing what you're doing. You need to just do it in the right way. Like if you are working in the office, you don't need to stop going to the office. You just need to use it in the right way. If you are lifting weight, you don't need to stop unless you are advised it's in a severe state where you maybe get a fracture of your back or you injure your back in a bad way, is when you need to stop doing activity. So for the women at home, they just need to do it in the proper way. Of course, when they lift the water on their head, it becomes, you just need to do it on the weight that you can maintain. And of course, use other methods, alternative methods to do the same work.
What is the recommended weight that probably a person, an adult of my, someone like me can carry?
That is really relative. That is really, really relative. It is, because weight and strength goes hand in hand with how much you've been doing. You can be, your muscles can withstand as much depending on how you've trained it. On average, we usually say about, because the normal weight of a human being is around 70 kg, 70 to 80. So it should not exceed, we usually say don't exceed your weight. So you do not carry something of over 70 kgs.
Okay.
Because it becomes injurious. But it is usually progressive. If you've not been lifting weight, you should not start with something heavy. It should be something progressive.
All right.
The other thing we need to talk about is pregnancy.
Okay.
As I said, sudden increase of weight affects your back. So the same thing with pregnancy, there's weight that has suddenly started to increase, and therefore it will strain your back. So as the person gets, when the person is starting to knows that she'll get pregnant, it's good to start just prepare your body in terms of exercises, increase flexibility, so that when you start gaining this weight, it doesn't strain your body.
Okay.
Yes.
All right. And we are having Dr. Gerald Wasena just delving into the matters back pain and understanding what is it exactly, what causes it, and what are some of the triggers. And so we will take this short commercial break, and when we'll be right back, we will be talking about some of the remedies that you can take at home. So keep texting at 22047. Only on TV 47 is where we care about your health. Do not go too far. Welcome back to TV47's Body Garage, where we are talking about back pain. And before the short commercial break, we talked about some of the causes for back pain. And before we touch on the remedies, Doc, and some of the things that people can do at home to prevent back pain, let's have some questions from the audience.
Okay. My name is Omar Russell, and I have two questions. One, are there any specific exercises?
Hold your mic, well.
Are there any specific exercises that I can do to ease back pain? And the other question, how can I prevent back pain from occurring?
Let's have the second question. And then.
My name is Frank Tiller, and I have a question. How can stress contribute to back pain?
All right. Yes, Doc.
Yes, so to the first question is prevention of back pain. Prevention is basically, there are preventable causes. There are preventable causes, then there are non-preventable causes. Like 95% is due to muscle strain or sprain. As I said, is due to repetitive movement of activities that affect your back. So as I talked about how you sit, how you are mopping, how somebody is mopping the house, how you are washing your utensils, and those, you can avoid those things that makes your back to be in a certain position. But of course, there are other causes that you may not really prevent, like infection. There could be accidents, other things. So but the 95% are preventable by avoiding activities that causes you to strain that particular muscles or segment of muscles.
Okay.
Back to the issue about exercises. I'm with my colleague, Dr. Collins, and we felt it is important for him to demonstrate a few exercises. Now, before he demonstrates, let me repeat what I said earlier. Joints in our body are maintained by movement. So every time you get back pain or even knee pain or any part of the body, unless you are told to restrain it, you need to keep moving. Now, the back gets weak over time. And that, when you get strain or sprain and you don't activate your back muscles, you get pain. And that pain makes you not to do activity, and therefore it becomes a vicious cycle. So the home remedies are, one of them are, as I said, keep moving.
Okay.
So my colleague will demonstrate, if you have back pain, there are some exercises that you need to do that can make you to get, to reduce the back pain.
Okay.
I think we'll start with the core exercises.
The core exercises.
So he'll demonstrate the core exercises, that these are things you can do even at home. Please,
Okay.
you can just demonstrate core exercises. So core exercises are to ensure that your muscles that are on your back are continue to be strong.
So perhaps you could show us.
Yeah.
Yes.
So this is plank. So when we are doing plank, you ensure that your elbow is bent and ensure that your curvature is maintained.
Okay.
And you can count to, if you're just starting, you can count to 10. But
As
if
you
you are
hold
up,
it.
yes, you hold it this way to 10. But the more you are pro, like some of us, you can go for 2 minutes holding this way.
So he can go for 2 minutes.
No, let us not spend 2 minutes.
Okay.
But the more you do it, the more you strengthen your back and also your abdominal muscles.
But the emphasis is that you have to ensure that your elbows are...
Because you make your support from... When you do this, over time you'll start feeling pain and straining on your back and your abdomen.
Okay.
The other thing for plank, I also advise for ladies who are losing their belly fat. Instead, especially those who are, instead of doing sit-ups, because when you have back pain, doing sit-ups actually strain your back more. So for ladies who are having time to lose your belly fat, you'd rather do planks, because it's also reduce it also makes your belly, your muscles on your abdomen to tighten up.
All right.
Yes.
What other exercise can I do at home?
Number 2, we're going to do side planks.
Side.
So lying on your side. And being supported
on one arm.
So you remember the back pain is all about your muscles to ensure that it is stable.
Okay.
So this also will strengthen your muscles on your abdomen, so both sides. So you do one side, then you turn to the other side. I think
and I realize he's not so 90 degrees. Is it okay, or let's say we should do it when you're 90 degrees?
Not necessarily. So long as this is supported and you're not straining it this way. This is not the right way.
Oh,
this
you
is
should
the right
be up.
Position. Yes.
Oh my goodness.
Yes. So that is the right position.
All right.
So there's a time, there's a very important exercise when, for patients who have what is called sciatica. I remember I say that sometimes you have this pain that comes to on your thighs and to your leg.
Okay.
It is due to something called a disc that is pressing on the nerve. So there is some exercises called Mackenzie exercises that are supposed to make sure that with over time it tends to reduce that pressure on the nerve. So you can do the
bird dog. So the bird dog, in that position, with one bent, then you can do that.
Okay.
So when you do this, you ensure that you are causing extension on your back, and this tends to relieve the pain, the strain on the. So you can count to 10, then you take the other side, count to 10. But the more you exercise this, the more you become even stronger.
And they're doable at home, right?
Yes.
Right? Yes, yes.
The other thing you can do, Doc, is to show them how to do the cobra. So this is a very good exercise that you need for people who are having pain on their buttocks. If you do this, you make it routine. Like every time you wake up, you do this cobra exercise.
So someone's body can actually bend up this way?
Yes.
Okay.
You can't remember?
I don't think I can. Do you think you can? It's difficult.
So you count to 10. This ensures that there's that extension on your back.
Okay.
And you count to 10, and you give it like three rounds. And these are exercises you can do at home.
All right.
Yes.
Okay.
Now, some of other home, you have other exercises?
Okay.
Okay, good. So
All right.
the essential thing is ensure when you get, you start, and again, this we need to do it routinely because you know you will definitely hurt your back. If you work in the office, you will definitely hurt your back. There's no way you can avoid it. So what you do is that you make this as part of your
routine.
Your routine. When you just feel some strain, when you go home, don't just go and sleep. Just do some exercises to ensure now your back is you counter, like if you have been doing this for the whole day, now go and
do it.
Try and do what you've been doing the whole day.
All right. So, and there are people now who might not have the time to perform, to do cobra, the planks and all. What other things can you recommend apart from the exercises?
Well, there's no other thing I'll recommend. Number one, I'm a surgeon. I believe I'm very busy.
Okay.
And I get back pain. Actually have back pain because of I bend a lot when I'm doing my surgery. But I've made it a routine. When I wake up after prayers,
then a little
exercise, just 5 or 10 minutes. It will save your day.
All right.
Yes. So
I think that is actually the point where we can wrap up and say the point is ensure we have a routine. Number 2, maintain a good posture, and the routine can be fixed in any part of any time of the day that you can wake up, and when you're at work, you can decide to have a walk, and you can save yourself from the pain that can come ultimately. And so for that, we say goodbye. Thank you for watching TV47's Body Garage. Do make sure that you watch us next week. I am your host, Sheila Chelangat.